Welcome to the recorded version of the Grantmakers and Aging web seminar, Working Collaboratively to Prevent Elder Abuse, Neglect, and Exploitation, featuring Secretary Greenlee, Assistant Secretary for Aging, Laura Rath, Senior Program Officer with the Archstone Foundation, and John Feather, CEO of Grantmakers and Aging, from March 24, 2014. This event was made possible by a partnership between Grantmakers and Aging, the John A. Hartford Foundation, and the California Wellness Foundation. Technical and production support is provided by the American Society on Aging.
Thank you, Steve, and welcome to all of our participants today. We have a large audience, and we're very grateful for your participation. Before I start, I want to thank the John A. Hartford Foundation of New York for providing continuing support for this webinar series, as well as the Archstone Foundation for their support of this particular program. I also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Today's conversation with GIA turns to a subject that is always difficult, but we know that elder abuse is shockingly common. 10% of older adults, that's 5 million individuals, are abused each year in the United States. Whether the form of abuse is defined as financial, physical, sexual, emotional, neglect, or a combination of these, it is devastating for the victims of this activity and those who love them. But with our growing knowledge about the aging process, systems of care, and healthcare reform, there is now an unprecedented opportunity to make a difference. Today we are going to focus on how the federal government and philanthropy can work collaboratively to prevent this awful reality. It is an honor to have two distinguished guests today to guide us through this topic. Secretary Greenlee serves in the dual roles of Administrator of the Administration for Community Living and the Assistant Secretary for Aging. She is the most senior federal official on aging and disability. Laura Rath is Senior Program Officer at the Archstone Foundation in Long Beach, California, which has long supported efforts to prevent and to conquer elder abuse. So welcome to both of you. Secretary Greenlee, let's start with you on the next slide. What do we know about the frequency and pervasiveness of elder abuse in the United States?
John, I want to just first start by thanking you for hosting this webinar. There are very few issues that I feel more passionately about than this one, so I'm glad to join you today as well as your many members across the country. You had indicated this first piece of information actually in the setup that 10% or approximately 5 million older adults experience abuse each year. You know, the workshop, certainly my section is titled the Federal Government Response, but I think the first section on this slide is very important, that this is a national problem, that it happens in every single community. And I know a lot of the funders that are part of Grantmakers and Aging are local community foundations or working at a statewide level. And so I would encourage everyone to just start this webinar by thinking, what is happening in my community? Because I want to talk about the federal response, but the response is really in response to what we should be doing at the federal level to help you and your local community. I had the opportunity 2 weeks ago, for example, in San Diego to meet with 5 victims of elder abuse, and it will change you and it will motivate you. And if you all listening don't have a sense of what's happening, I think that's the first place to start. It's a national epidemic, 5 million a year. We also know that people who are abused are also 300% have higher rates of morbidity and mortality than non-abused persons, as shown by that piece of data on the slide, and that most reports are that elder abuse doesn't get reported, that only maybe 16% of elder abuse ever comes to the attention of authorities. Most of this is a hidden problem, and I think the first thing we need to do is find out, all of us, what's happening, who is it happening to in our communities, in our states, and at the national level.
Administration on Aging and the federal government's role in combating this issue.
So we have a number of programs at the Administration on Aging that have always been in place to help deal with elder abuse. In fact, the Long-Term Care Ombudsman Program that was added to the Older Americans Act in 1972 came as a result of really an expose about what was happening to residents of nursing homes in this country who were experiencing abuse. We also fund a National Center on Elder Abuse and have provided some abuse, neglect, and exploitation programs. Those programs have been aimed at working at the state level to provide some ability to get some attention to this issue. The Elder Justice Act is a new authority. It was passed as a part of the Affordable Care Act, and it provides us some new opportunities to really push this out further, reach more federal agencies, and begin to make the investments that we need to make so that we can get more information and provide more support. I think the thing that I want to make sure that people understand on this slide and in this webinar is that the federal government has had these pieces that are shown on this slide, but we've had no federal office that dealt specifically with elder justice, specifically with adult protective services. There's simply never been a federal infrastructure built. So we have historic experience and some new opportunities through the Affordable Care Act.
Let's go to the next slide. Given those authorities and the activities that have been in place for, in some cases, many years, what is the administration proposing to address this at the federal level at this point?
So what we have is the President's fiscal year 15 budget, so the budget that he just announced at the beginning of March this year, would put $25 million towards an elder justice initiative. That $25 million is really meant to, for the first time, develop a national office and put in place adult protective services systems. For example, we don't have a national database. Each APS system that exists has been built on a state-by-state basis. Each state collects their own data. I mean, think about something as simple as the age categories each state captures or the types of abuse each state defines. So part of what we need to do with a $25 million proposal is really build out a national database and infrastructure. We also need to find out what the best practices are for adult protective services. Unlike child protective services, there's really not an infrastructure, and so we don't have the ability to engage with states, to push out best practices, to do training. All of these were called for in the Elder Justice Act and have been really highlighted as we've worked with our other federal partners through the Elder Justice Coordinating Committee. The last thing, which is in the middle of your slide, is the need for additional research on abuse. What are the profiles of people who are abusing older adults? What are the profiles of those people who are abused, and what would be effective? The other thing I want to make sure we point out while we're on this particular slide is that we talk a lot about elder abuse. This particular proposal helps both address elder abuse, but also puts together adult protective services. And in most states, adult protective services covers people of all ages, kind of 18 and older. So we really need more information about both people with disabilities, people with mental health problems, a general population, as well as older adults who are subject to abuse.
Go on to the next slide. And this is a critical one that you've already talked about a little bit, but how can our audience be involved in this? What can they do to address this issue?
Well, everybody here is in Grantmakers and Aging, and I do a lot of national speeches, and the best way that I can describe this is if we're working with older adults to support them, we have to talk about elder abuse. It has to be seen as a core competency of what we're doing, or we're overlooking our ability to help provide support for victims and eventually solve the problem. So I encourage people to learn more about it. That's where I started. What's happening in your community, both to the people, and it's always good to go back and talk to the victims themselves, to the people that this is happening to, understand the financial and physical and emotional toll this takes, but also figure out how you can incorporate it into the work that you're doing. And I can give you a specific example. I mean, the Administration on Aging has been supporting family caregivers with a National Family Caregiver Support Program for well over a decade. And recently I was talking to someone who'd been doing family caregiving work who said, we never thought about it. We never thought about how we should integrate elder abuse screening into what we're already doing. The other thing that's important is to understand that it's a very complex issue. John, this was also kind of part of your intro when you described all the different kinds of abuse. It will take everybody in the community to respond, from kind of the human services component, law enforcement, your medical community, your financial services community. And the best community response and state response really is a result of collaboration. So I think it's important, and it's important that we have foundation support as well, so that we can really create a public-private partnership.
And as we move to the completion of this part of the presentation, there are some resources that you have listed here. Do you want to tell us a little bit about what this provides for our audience?
So when the Elder Justice Act was passed, it called for two kind of organizing bodies, and one of them is the first one that's listed on this resource, the Elder Justice Coordinating Council. We created the Coordinating Council about a year and a half ago. Secretary Sebelius is the chair. The Attorney General Holder, is kind of almost designated as the vice chair. Certainly the leadership from this Coordinating Council has been from Health and Human Services, the Department of Justice, Social Security Administration, and other key federal partners who can and should have a role in addressing elder abuse. We've met over the course of the past 18 or 20 months and come up with 9 proposals on the ways the federal government could increase our involvement. And those are everything from providing more guidance so that financial institutions know when they can share information if they suspect there's abuse, to what we need to do to provide more education and awareness, screening for medical professionals. Those proposals are all listed as the first resource. The $25 million that the President has put in the 15 budget for AOA is listed as the second resource, so you can see how that breaks down between the database, the infrastructure, the research, the best practices. And then World Elder Abuse Awareness Day happens every year in June. It's June 15th. I think that falls on a Sunday this year. We always like to kind of pay particular attention at that point in time, encourage people to do local events, and talk about the fact that this is happening really all over the world, and we need to stop and really pay tribute and respect to the people who've been abused, but really recommit ourselves for the next year's work. And then there's how to get a hold of us. Edwin Walker, who's our Deputy Assistant Secretary for Aging, has his contact information there. He's been the key staff person who's been supporting me as I work with the Coordinating Council and also with the various stakeholders who are interested in moving this forward.
Well, thank you very much, Secretary Greenlee. We'll be talking to you a little bit later again. Before we move on to our next speaker, I want to remind our audience that at the end of this presentation, we will turn to your questions. You can go ahead and write those in at any point. You just go to the control panel that you see on your screen, go to the section that says questions and open that up, and just go ahead and type your questions in at any point. So as we go to the next slide, Laura, let's talk to you next. And as we'll go to the next one after that. What have you learned in the work that Archstone has done in funding programs in this area?
Thanks, John. First, a word of thanks to Grantmakers in Aging for hosting us on today's webinar, and also our thanks to Assistant Secretary for Aging Greenlee for bringing attention to this really important issue. I look forward to sharing some practical ways in which other funders may incorporate strategies to address elder abuse, and also to briefly sharing the approach taken by the Archstone Foundation. In terms of applying lessons to existing grants and programs that serve older adults, I think that these 3 summary questions from Assistant Secretary for Aging Greenlee outline a clear framework for agencies to follow in their approach to addressing elder abuse and neglect. Because among the older adults already being served, there are certainly those suffering abuse.
Okay, if we go to the next one, how can elder abuse be integrated into other programs so that if someone says, well, we're not going to start an elder abuse program, funding priority in our foundation, how can they be involved?
Thanks. I think that's a great question. And elder abuse is a problem that we can address, but it will take a thoughtful, coordinated effort in order to do so. And here are just a few examples of programs that foundations may currently support that could be enhanced to include elder abuse. We already heard about incorporating addressing elder abuse or screening for elder abuse into caregiving programs. Also, I would like to briefly highlight transportation programs, in that isolated older adults are more likely to be victims of elder abuse, and therefore older adults friendly and accessible transportation and increased social connections may serve as a protective factor. Also, as we've learned from work conducted through the National Center on Elder Abuse, headed by Dr. Laura Rath, again, we've learned that caregivers will speak about the issue if they're asked in a thoughtful and compassionate manner. Additionally, older adults with dementia are more likely to be abused. In fact, it's been found that nearly 1 in 2 people with dementia were abused by their family caregivers. So just as child abuse is included in professional training for health professionals, so too should elder abuse. And I think family practice physicians, nurses, dentists, occupational therapists, just to name a few, also need to be trained to recognize and report cases of abuse. And finally, faith communities may be well positioned to identify abuse and provide counsel to victims.
As we go to the next slide, the Archstone Foundation has been a longtime leader in this program. Could you tell us a little bit more about the foundation itself and why it was that the foundation felt the need to be involved in this?
Yes, thank you. So the Archstone Foundation is a private grant-making organization whose mission is to contribute toward the preparation of society in meeting the needs of an aging population. We're located in Long Beach, California, and the foundation awards approximately $5 million in grants annually.
Okay. And on the next slide, the major program that you've been involved with for a long time now is the Elder Abuse and Neglect Initiative. Can you tell us a little bit about that initiative?
Sure. So recognizing the terrible epidemic facing the older adult population, the Archstone Foundation launched an initiative in 2005 with the goal of improving the quality and coordination of elder abuse and neglect services in the state of California. And I think this is an example of what Assistant Secretary for Aging Greenlee spoke about in terms of foundations taking a local approach within their own communities to addressing the issue. The criteria for selecting elder abuse as a focus area were as follows. First, the foundation's past history with the topic area. Second, that the area posed a significant problem to society. And third, that the problem required outside resources in order to move the field forward. During the course of the initiative, the Archstone Foundation awarded approximately $8.5 million to 22 projects in the Elder Abuse and Neglect Initiative, which lasted from 2006 until 2010. However, in total, since 1991, the Foundation has awarded over 116 grants in the area of elder abuse, totaling over $14.8 million. Currently, as a legacy issue, the Foundation continues to support projects related to elder abuse and neglect that either build upon or serve to disseminate the work that was undertaken during the formal initiative.
We go to the next one then. What categories of funding were supported by this initiative?
Right, so you can see from this slide that projects included in the Archstone Foundation Elder Abuse and Neglect Initiative included support for forensic centers, the development of multidisciplinary teams, education and training for mandated reporters of abuse, and financial protection projects, among others. Additionally, convening, technical assistance, and evaluation were also an integral part of the design of the initiative. And I'd like to emphasize, however, that although the Archstone Foundation invested in an initiative-based approach, individual projects like support for a medical training program on the topic or support for a local multidisciplinary team in your area can certainly serve to have significant impact within a community. And integrating elder abuse programs into existing programs supported by your foundation, such as the transportation or caregiving programs that we discussed earlier, can be an important first step in improving the lives of older adults by keeping them safe and free from abuse.
So as we go to the next slide, what have you learned from all of these wonderful efforts?
Well, thank you. So a few of the lessons learned that I'd like to highlight include making a commitment to strategic grant making. And in order to change the culture around the way elder abuse is perceived in our society and to develop lasting systems to respond to the crisis, we would encourage other funders and foundations to take a long-term, multi-year investment in the issue. Second, we would encourage innovation in your grant making. Each community will have unique approaches to providing quality services. So using a general format and common core elements, such as a multidisciplinary team, you can encourage your community to create a structure that will best serve their unique needs and will optimize their special talents and resources. Exhibiting flexibility in implementation will help seed new ideas and create those best practices. And finally, we learned about the power of leveraged resources. So in total, for every dollar that the Archstone Foundation invested, an additional $1.93 was leveraged. We believe that because there is still so much need in the field of elder abuse, other funders would likely see a large return on their investment if they also decide to support projects in the area of addressing elder abuse and neglect.
All right. As we move to the next one then, are there other foundations working in this area?
Oh, yes, and just first a note, additional information is available. That's fine, no, but just additional information is available on the Archstone Foundation website. First, in a report entitled Defining the Future, which you see pictured here. Additionally, the projects of the initiative were also featured in a 2010 special issue of the Journal of Elder Abuse and Neglect.
So as we move to the next slide, that's the one I was looking at, unfortunately. Are there other foundations working in this area?
Yes, and we think it's so encouraging that other foundations have expressed interest in the issue of elder abuse and neglect since the Archstone Foundation launched its initiative. And just a few of the examples include those listed here. First, in 2011, Marie-Therese Connolly received the prestigious MacArthur Fellow Award for her career-spanning work in elder justice. Currently, she's creating an integrated national advocacy effort to prevent, detect, and intervene in elder mistreatment. In this case, the award itself certainly brought national attention to the issue. Secondly, over the last year, Archstone has been in conversation with Katie Midgley, a program associate at the Plow Foundation in Memphis, about work the Plow Foundation is currently supporting to spearhead a community coalition on elder maltreatment, where they are working to promote communications and interagency collaboration. And finally, the Harry and Jeanette Weinberg Foundation is currently in the planning stages for an elder abuse initiative. When I spoke with Michael Marcus earlier this year, he said that over the next year, they plan to make a multi-million-dollar investment in the issue, potentially related to their past support for elder abuse shelters and direct service programs. So again, this is really encouraging.
It is definitely encouraging, and we'll move to the last slide, which is the contact information. But we want to now turn to your questions, and as a reminder, you can type in your questions at any point. Just go to the control panel slide that you see on your screen, and go to the question section and open that up, and then type your questions in. So we've got a couple that I will start with. So I will start with you, Secretary Greenlee, and you had mentioned that it's important to know about your own community. Are there places that you can go to find out more about the statistics on elder abuse in local areas?
So I think you probably should start with whatever you can learn from your state adult protective services organization on what they can give you if you want. I think the closest thing we could probably come up with regard to hard data. You could talk to an area agency on aging or local aging service provider if you want more kind of qualitative data about what's really happening, what the referrals are, how frequently they see this issue. And because this is state by state, and there's no federal kind of database, I don't know, the likelihood that you could pick a city in a specific state and be able to know exactly kind of what's been reported. And like I pointed out, it's tremendous problem is underreporting.
Let me do a follow-up on that. Is there a potential that this will be a reportable condition like many are already, or is that in a too distant future?
Do you mean
that we'll be able to collect this information in some more standardized way nationally?
So it's collected at the state level, and because every state kind of built their own system, what we're doing right now with a little bit of money from the Federal Prevention Fund is really doing a survey of the states to get a sense of what is everybody collecting. From there, what we're hoping to do with some of the $25 million in the 15 budget is to come up with a national infrastructure and some money to states for demonstrating how they could then connect with a federal database. This is one of those federal programs where people should just think upside down, where it was built local first, federal last, and we're now trying to play catch-up in some respects so we can follow along the states, find out what they're doing, and from there start to put together a national perspective so we can look at sort of the scope, but also what the types of services and supports are that are most effective.
Okay. This is a question mainly having to do with providing resources in rural areas. And it's specifically around the Certified At-Risk Adult Crime Tactics Specialist training. And looking for, are there ways to fund, I would say, if we want to expand it a little bit, to fund training like that, which is to try to help people that are on the ground, frontline caregiver professionals or others, in terms of helping to identify potential victims of financial exploitation or others. Do you have a sense of that? And I will ask Secretary Greenlee first, but then Laura Rath, if you know of any programs that are working on this specifically.
So I mentioned the Elder Justice Act when we were going through my slides. That was passed as a part of the Affordable Care Act. And the Elder Justice Act is very broad in scope. As funders move into this space and start trying to figure out, where can we make a difference, I think it gives people a good lay of the land on what the advocates in Congress were thinking about the different types of opportunities. One of the things that was framed, and this was authorized, it was not funded, was additional training for law enforcement. It's additional support for the Long-Term Care Ombudsman Program, national background check. This really was comprehensive in its own kind of funding landscape, so to speak, because it really points to the opportunities. I think law enforcement is a critical partner, and that's why we work so closely with the Department of Justice, but it's also critical that at the state and local level that the law enforcement agencies be brought into this conversation so that they can see, again, what they already know, which is the fact that this is happening in their community. I don't have dedicated funding through AOA. The President's budget for us wouldn't dedicate funding specifically for law enforcement, but it's very much something that's needed.
Laura, do you know of programs like this?
So I'm not sure if it would specifically address this question regarding rural training, but I would direct folks as well to visit the National Center on Elder Abuse website, where there is a repository for training information on that website. And also wanted to highlight some work that the Archstone Foundation has supported through San Diego State University, and that's through their Project Master, which has developed, in this case, some core training modules for adult protective services. However, a number of these modules have since been translated into e-learning modules or online modules, and that's been done in conjunction with the National Adult Protective Services Association, and that's available on their website as well. So those might be some resources to begin with.
Okay. Another question, how are financial institutions such as banks involved in the process of preventing financial exploitation. Are there specific training materials or other kinds of resources available to financial institutions, and how does that process work? Either one of you can address that one.
So I would suggest if people are interested in sort of the scope of training materials, they get in touch with Paul Smoser at the Financial Services Roundtable. Paul has been very active with the Elder Justice Coordinating Council and providing kind of public testimony, expert insight. There are a number of large financial institutions that have put together a training protocol and really just need to get the support to push those out kind of everywhere in their organization. Some of the key issues that have come up to us from financial institutions have to do with how they both kind of report financial exploitation or suspected abuse of other types and still deal with the privacy laws that apply to banks and institutions. There are ways around that. There are specific abilities for banks to file reports, but we work closely with the Consumer Financial Protection Bureau. The Department of Treasury is also involved with the Coordinating Council. But the banks are doing a lot, and I think want to do more. At least that's the sense I get.
Okay. All right. So the next question is there any information about guardianship monitoring projects that are recommended by the American Bar Association? And mentioning that some states are starting this process, do you have any information on those programs?
I don't. If you're talking to me specifically, I don't have that information gathered here. I mean, it's come up in a slightly different way. I guess that's the best way to describe it with the Elder Justice Coordinating Council. The states have information about guardianships, because who's under guardianship, when guardians are removed, when the guardianship is no longer in place. But there's no interface between a state court and an entity like the Social Security Administration, where people are put under a representative payee program if they're having trouble managing their assets. That's the kind of federal interface that we're really kind of talking about. Can this be addressed in some way? Guardianship abuse is kind of one of its own very complex domains within the larger sense of elder abuse, and again, will be very state-based and very kind of judicial-based in the fact that it's about interacting at some point with the judicial system and making sure that we have sufficient guardians, that we don't have inappropriate guardianships, and that there's some monitoring if someone is under guardianship.
Laura, here's a question for you. If you had the ability to ask local funders to fund one or two programs in this arena, what would it be?
So again, I think it's a great question. I think it really depends on the resources, again, and talents that are available within that community. But for a lot of communities, I think a great place to start is with some of the multidisciplinary team efforts, where you can look at the interface between adult protective services, law enforcement, your local district attorney's office, and then the array of first responders and service providers who might be working to address elder abuse within your community. And I think in a lot of ways that's how the Archstone Foundation was first introduced to work being done within our community. And in addition to that, the Archstone Foundation has also long supported programs to support caregivers, and I think that's another critical entry point to helping to address this issue. So those would be, I think, my two suggestions for funders to think about how they might begin to help address this issue within their communities.
John, can I chime back in and just
Sure.
say here to what Laura said?
Yes.
I mean, in her slides, she talked about Archstone's support for forensic centers. If the funders on the phone, the Grantmakers, are not familiar with that, it's worth your time to learn more. I visited a forensic center in Los Angeles, and it's very impressive. The assembly of professionals around the table who talk about the complex cases, from law enforcement to geriatricians and psychologists, service providers. The Elder Justice Act, which I've mentioned, which is largely kind of not funded at this point, also, if fully funded, would expand the number of forensic centers around the country so that we really have an interdisciplinary, multidisciplinary approach. The issues of elder abuse can be exceedingly complex, especially when we're talking about dementia and people who need long-term supports and services, where to get those services. So I just want to chime in on Laura's answer about how important multidisciplinary work is.
Thanks, Kathy. And I can go on to add that forensic centers are, in a sense, maybe the next evolution or the next step in a multidisciplinary team where you have, just as Kathy said, the expertise of a geriatrician or a geropsychologist, that true medical expertise to help add around the table to Adult Protective Services, law enforcement, and the district attorney's office. And I think, with those forensic centers, there's not the funding support for the services that the geriatrician or neuropsychologist can provide, whereas there are, some limited funds, although siloed at this time, for Adult Protective Services and law enforcement to conduct the investigation, but often those investigations really need the expertise of the medical piece in order to move forward with their cases.
Thank you. Secretary Greenlee, back to you. You've actually talked about this a couple of times, but a question to further that. You've talked about the Coordinating Council and the work of the Consumer Financial Protection Bureau, but I'm not sure everybody will be familiar with that. So could you say a little bit more about that? And also the question that is being asked here is, how does your administration work with that agency specifically, and then with others in the Coordinating Council?
So the Consumer Financial Protection Bureau is a relatively new federal organization that was created in response really to the economic downturn, financial crisis, as really a consumer voice. There is a subsection that deals specifically with older adults. Nora Eisenhower is currently the leader of their Office of Older Americans. Skip Humphrey was her predecessor. They focus specifically in CFPB on the older adult section on financial exploitation. And financial exploitation of older adults, to my knowledge, is the largest category and sort of the overall realm of abuse. It's also likely to be an area where we continue to have growth because we'll have just more and more older people with assets. We work closely with CFPB. I mean, they have a specific charter, the ability to go around the nation and talk to banks. They have kind of access to a whole financial services world that's a little bit just different for both HHS and AOA. They also are active participants in the Elder Justice Coordinating Council, especially as we talk about how the federal government can share information back and forth with states and with banking institutions.
That's great. A very impressive and passionate group of folks who have had a chance to get to know. A question, we'll go back to you, Laura, about a local issue, and this is a question around that sometimes it's very difficult to find speakers who can talk articulately about these issues. These are not easy things to talk about. And a question about starting a local Community Speakers Bureau. And have you seen good models for these kind of speakers bureaus or other kinds of ways to get the information out effectively into the local community?
I think that's a great question. And I can speak from, Archstone's experience here in the Los Angeles area. And again, I think it begins with learning kind of who's working in this issue area and having those, maybe one-on-one conversations, starting with, your local APS social workers or, looking to, if it applies in your area, to geriatricians that might be working in the field to address the issue. And it's true, it is, I think, a sensitive subject and someone that also we really want to have good information and get good data out into the community when we do address the issue, and does need to be handled with care. So I think starting, with having those one-on-one conversations and meeting the people that are doing the work would be the way to start identifying kind of the star speakers within your area. I would also like to add that there's a grassroots movement called the Ageless Alliance, and you might be able to connect with them online if you look up Ageless Alliance and see if they have suggestions in your community as well for people working in this area.
John, I might just chime in that we haven't mentioned state attorneys general, but they also are another good resource, especially if people are looking for both kind of law enforcement support, but also education. I first ran across this issue of financial exploitation when I was a young assistant attorney general in the state of Kansas. This is a many-colored issue in terms of having very many facets, and it came in my door, landed on my desk because of the Consumer Protection Act and our ability to try to chase down some of the fraudsters who were scamming older adults through telemarketing and junk mail. So you've got experts around the state. They may not all think of themselves under a broad header of elder abuse, but there are certainly people in every state, in every community who have seen what happens to older adults who can be brought together as a resource.
Well, let's stay with you for the next question, which is sort of a follow-on to what we talked about before, but do you anticipate that there will be the creation of a national clearinghouse system so that states and other organizations can submit materials, maybe best practices, models that have worked and so forth, that can be shared with other communities?
I desperately hope so, and I think that's the best way to describe it. We need it. We need some way to be able to find out what's effective in the states and start driving towards kind of national standards, and I don't mean that by regulations, but really national best practices on what a well-functioning adult protective service system would look like. This is one of the core elements that was really set forth in the Elder Justice Act, which again kind of describes a broad range of places where we need to make investments. You know, I've worked in the field of aging for a long time now and rarely compare aging services to services for children. Typically that's just dangerous territory and not necessary. In this case, I think it's actually helpful. There's a large national system and federal support, dedicated support to states for child abuse enforcement. And the whole Child Protective Services system really is kind of an ebb and flow, back and forth exchange between local communities, states, and the federal government, where the federal government can help provide education, can help set standards, can gather national data. We have no infrastructure at the federal government that even approximates what we put together for Child Protective Services. They're not similar at all. We've got a well-robust system on the CPS side, but not for APS.
Very well said. Thank you. And yes, it absolutely is a critical need. Laura, as we turn back to you again, one of the things that Archstone has also been involved in, you've also mentioned, is not only the abuse and neglect issues, but also care of persons with dementia and also the family caregiving aspects. Could you touch a little bit more on how those pieces fit together and how you reach out to individuals in an effective way who may be much more vulnerable than others?
So I think in regards to dementia, we've learned that for those older adults suffering dementia, it's unfortunately much more likely that they might suffer abuse from those that are tasked with taking care of that older adult. So I think, what starts there is, just with the recognition of that as an issue. And then, thinking about how to thoughtfully include addressing elder abuse within those populations. And it doesn't necessarily mean that would be the case. And the same with caregiving. And certainly not all caregivers would be abusers, but unfortunately, for a number of older adults, the vast majority of the perpetrators of the abuse do happen to be in a caregiving role. So within caregiving programs, currently the Archstone Foundation is supporting work at the University of California, Irvine, to study ways in which to best approach the topic of elder abuse for that caregiving audience. And that's work that's currently being undertaken in terms of hosting those focus groups with a caregiving audience to explore ways to best approach the issue and address it with those caregivers. So I think a lot of work, certainly still needs to be done in both of those areas, but that they're so critical to think about for foundations that are supporting work in either of those areas.
Let me follow up that question just a little bit in a slightly different context then. We do know that of the sometimes terrible stories around both family and professional caregivers who are responsible for these really heinous activities. How do we involve caregivers in a way that is positive, non-accusatory, and helps everyone to move forward on this issue? I think particularly in terms of the folks who are providing care either in the home or in facilities.
Yeah, so I can start, and certainly if Kathy has additional information, be welcome to that as well. So I think we're learning, how to best address it. And again, it first starts, just with the recognition of the problem, and additionally having the supports and resources available to caregivers. I think some of the discussion that we've had with University of California at Irvine is that certainly when new mothers come home from the hospital with their babies, they're given information about shaken baby syndrome and how to kind of recognize before it happens, what would be considered abusive behaviors. And, currently there's no similar training offered, for caregivers. And so many caregivers of older adults, really are thrown into that role and may not even self-identify with the label of caregiver. It's just kind of part and parcel to what they do, taking care, it's my mother, that's just, what I would do. But at the same time, they aren't given the resources, supports, and help to know where to turn if they do need help. Or to really understand along the continuum what behaviors are, appropriate and, certainly, what would be considered inappropriate, neglectful, and then further down the continuum considered abusive.
John, this is Kathy. Yeah, I would, I guess, just add to that as well that often I think it starts back with adequate care planning for the older adult themselves. I mean, as someone needs more services in community as they age or become more frail, we should not rely on, as a society, I think one person as a caregiver to provide all of the support. And good care planning really draws upon multiple resources. What are the resources in the community? What resources are in the faith organizations? Laura had them listed on the slides. What can the family provide? I mean, good care planning can also relieve some of the burden and stress from the caregiver and break through isolation. Because as Laura mentioned, isolation is a huge risk factor. I think the two biggest risk factors are dementia, cognitive impairment, and then isolation. So everything we can do to make sure that the older adult sees other people, has multiple people in their lives, other outlets and resources that helps not just the caregiver but the older adult themselves.
Well, that's wonderful. We're coming to the end of our hour, and although we have additional questions, I'm going to now ask each of you to provide our audience with some final words. But before I do that, I do want to ask you, Secretary Greenlee, about a topic that is near and dear to some of our funders' hearts, which is the every decade White House Conference on Aging. And I wanted to ask if you wanted to say a few words about the current plans for the White House Conference on Aging and any updates we have on that.
So, yes, I'd be glad to, John. If we stay on the 10-year cycle, decennial cycle for the White House Conference, the next one would be 2015. The White House is very interested in hosting a White House Conference. We had a good conversation a couple of weeks ago with some of the key stakeholders, at least the ones here in Washington who've been following this issue. In the fiscal year 15 budget, the White House has put $3 million dedicated specifically to having a White House conference. I think the commitment that we have at this point is to build the best conference we can that reflects current technology and how we can use technology to get national participation, to get input directly from older adults and their caregivers. The conference will be a little bit different than prior conferences. Those conferences were all very structured based on the law. The Older Americans Act, because it wasn't reauthorized yet, doesn't have that same structure in place. So we can build something that works the best, I think, for right now. What we will do is hire an executive director. The White House is committed to making sure that, because aging issues are broad, that we draw upon the resources across the federal agencies, because the areas certainly touch housing, transportation, well beyond HHS. So we will get started and put something together. I don't have a date yet. We need to staff up. We also need to talk about sort of funding options. I mean, this $3 million is in the president's budget, and we need to put together just our financial plans. If that's realized or not realized, it changes the scale, but certainly not the commitment of the White House to have a conference.
Well, thank you very much for that. I know that we will be having more discussions about the support for this effort in philanthropy going forward. And obviously this topic of today's webinar will be part of that teleconference. So I want to turn now to each of you for your final words to our audience. Laura Rath, let's start with you.
Thank you. And in closing, I would like to extend my thanks to the audience for your interest and attention to this issue, as well our thanks to ASA, GIA, and Assistant Secretary for Aging Greenlee for bringing attention to addressing elder abuse at the local, state, and federal level. I'd also like to extend an open invitation for other foundations who are considering work in this area to please feel free to contact me with any questions you may have, and we would be more than happy to share any of the materials that may be of help to you as you consider ways to address elder abuse in your community.
Thanks so much. Secretary Greenlee?
Thank you, John. First of all, thanks again for having this webinar and having so many participants from GIA. You know, you opened by saying that this can be a very difficult topic to talk about, and it is. I also opened by saying, you know, we really need to keep talking to older adults themselves and realize that the key to moving forward is really leadership. We need leadership from every single person who's working in the field of aging to make this a priority, to really pay attention to the lives of the older adults and understand that nothing else that we do will be as effective if they're also abused at the same time we're supporting them. I met, like I said, with abuse victims, and they'll stay with you forever. The woman who served her country, served our country for a long time, who really cried the whole way through the presentation with me, talking about, you know, kind of what's wrong with us that this hasn't been a priority. We were focusing that day on financial exploitation, but the emotional devastation to her was really clear. This is happening all the way around us, and if we don't step forward, I think we're missing the opportunity to lead. I actually think working in this space is not depressing, but exciting, because it's someplace where attention is so desperately needed, and I think right now is the time to move. I think we can make a difference. I think we need to support the president and this budget request. Well, we can do this. I mean, this is not insurmountable. We can do this. We just need to make a commitment to actually see what's happening and take a step forward.
Well, I want to thank Secretary Kathy Greenlee, who is Assistant Secretary for Aging and also Administrator of the Administration for Community Living, and Laura Rath, the Senior Program Officer at the Archstone Foundation, for joining us today. I will say that this is a difficult topic, and I think the passion that both of you bring to this is really an exemplar for all of us about how we can move forward in this really critical issue as you say, Secretary Greenlee, if we can't do this, what are we in this business for? I also want to thank the John A. Hartford Foundation and the Archstone Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. And finally, I want to thank all of you for participating in today's webinar. Have a great day.